In this video, we will be taking two important topics. One is STD or sexually transmitted diseases, infertility, and to overcome infertility, we have certain assisted reproductive techniques or ARTs. So, STDs, sexually transmitted diseases, or venereal diseases, VDs, venereal diseases, or RTI, reproductive tract infections. These diseases are totally transmitted from one person to another during the sexual unprotected intercourse. So, some examples of STD or sexually transmitted diseases are gonorrhea. Gonorrhea is a bacterial disease, and in this we have painful urination. Another is genital herpes. It is a viral disease. Genital warts, it is also a viral disease. Hepatitis B is there, and through unprotected oral sex or sex, this disease is transmitted. Then of course everybody knows about AIDS, acquired immunodeficiency syndrome. It is caused by human immunodeficiency virus. Then syphilis, it is also a bacterial disease. So all these diseases are curable except hepatitis B, AIDS, and genital herpes. These are not curable. Hepatitis B, genital herpes, and AIDS are not curable. Rest are curable. Then how can we be safe from or prevent these diseases? So we should avoid sex with unknown partners, or we should not be involved in the multiple sexual intercourse. Then we have to use, we should use the protection during the intercourse, such as condoms and other protective devices can be used. So this was about sexually transmitted diseases or venereal diseases or RTI. Next is your topic, infertility. So in the last, from the very beginning, when we are talking about the reproductive health, overpopulation has become a problem. At one side, if overpopulation is a problem, then infertility is also a problem, where a couple is unable to produce children due to maybe physical unfitness or congenital disorder or diseases, or because of psychological stress or due to drugs. So all these are factors which are leading to infertility, and that is a condition where a couple is not able to produce the children. So we have in our medical sciences developed the assisted reproductive techniques or ARTs, in which the infertility can be overcome, and these are one of important ARTs. One is your IVF or in vitro fertilization. In vitro fertilization, the child produced or the baby produced because of IVF is also known as test tube baby. If we see the history, the first test tube baby of India is Kanu Priya Agarwal, also known as Durga. and she was born in 1978. India's first test tube baby. In this technique, the fertilization, this may be due to the obstruction in the fallopian tube. When there is obstruction in the fallopian tube, the fertilization cannot take place. So, in this technique is done, that the zygote or fertilization is done outside the body in the same conditions as of the body, and the egg from female, because female, if it is producing normal eggs, then the eggs from the female can be taken and the sperms from the father, they are taken. They are fertilized outside the body in a test tube, and the zygote is produced. Zygote is allowed to multiply till 8-celled stage. It is then transferred in the fallopian tube. That condition is known as ZIFT, zygote intrafallopian transfer, because the zygote is transferred in the fallopian tube. Then, if it multiplies until 32-cell stage, the embryo is transferred directly in the uterus. That is IUT, intrauterine transfer. So these are the techniques of in vitro fertilization, where the female either is having a obstructed fallopian tube or is not able to lead to the fertilization. Another technique is GIFT or GIFT. The full form is gamete intrafallopian transfer. So as the name suggests, the gametes are transferred in the fallopian tube. This generally occurs when a female is not able to produce healthy ovum, or there is the problem in the ovary. So the eggs or ovum from the female who are healthy are taken and inserted in the fallopian tube of the another female, and then the fertilization can take place, because the condition should be that one of the fallopian tube should be functioning normally. Another technique is artificial insemination. In artificial insemination, if the male partner is unable to produce the sperms in the count or the number, or he is producing less sperms, then the sperms from another male donor are taken and artificially inserted in the directly either in the ovum, that is ICSI, intracytoplasmic sperm injection, which is given directly in the ovum, or it may be IUI, intrauterine insemination. So by these techniques, the infertility can be overcome, and the couple who cannot produce give birth to the children can produce children. So in this reproductive health, we have studied the control of overpopulation at one side, and also the reproduction from the infertile parents or couples. And with this, the reproductive health chapter is completed.